While the EPA is concerned about cleaning up Butte's Superfund site, there's also concern about people being exposed to dangerous chemicals. MTN's John Amy reports on what a new health study will focus on.
The Environmental Protection Agency recently made the cleanup of mine contamination in Butte a priority. Part of that includes studying how contamination affects human health.
Years of mining contributed to dust in the older homes in the Butte Priority Soils Operable Unit.
The EPA and health officials responded with an abatement program to systematically remove harmful elements from homes and soils.
We go into homes and clean out attic dust, and we go into yards and sample soil. And so if we find lead mostly, but arsenic or mercury, we'll go up to the point where we remove the soil from the yard and replace it with new sod.
The EPA is in the process of a new health study that will be released next summer to monitor the community's health. The first study results from 5 years ago showed the process appears to be working.
And that study concluded that the blood lead levels of children living in the Butte Priority Soils Operable Unit had declined to the point that they were equivalent to the blood lead levels of children on the flats.
Health officials point out that there are other factors, including economic and the social stigma of living in a Superfund site that could lead to other health complications.
Our children are affected by being labeled as children of a dirty water, quote unquote, town. Does that have a psychological impact? And the whole economic impact. Do people have good paying jobs, or are we missing out because of our Superfund stigma? Are we affected in ways that could ultimately affect our health?
Part of that study will include a committee dedicated to environmental justice to see how these factors play in human health. In Butte, John Amy, MTN News.
By the way, that new health study is expected to be released in July of 2019.